Hey, Sacramento Port Fire, this is Dr. Mackey. We're going to blast through some pain management here. This is policy 8066. Quick notes on the protocol side of things. 4 conditions are called out: chest pain, burns, trauma, and other. Remember, pain is easier if you divide it by visceral versus somatic pain. Visceral pain is more responsive to the opiates. That is going to be your abdominal pain, gallstones, pancreatitis, kidney stones. Somatic pain, like burns and fractures and dislocations, are more responsive to ketamine. All of these except ketamine have a blood pressure requirement. Blood pressure has to be greater than 90. All of them, the respiratory rate has to be greater than 6, and all of them, they have to be moderate to severe pain. Now, in the policy, there is a pain scale that goes from 0 to 10. Moderate to severe pain is anything from 4 or above. So for patients with conditions that require pain control, their pain scale has to be 4 or above. Systolic blood pressure greater than 90, respiratory rate greater than 6, except if you're using ketamine. All right, so let's move on to the protocol. BLS treatment is standard. Supplemental oxygen is needed in transport. If you're going to use one of the pain medications, you're going to pick one and you're going to stick with it. So for fentanyl, for cardiac, burn, trauma, and other, it is 1 microgram per kilogram IV, IO, or IN slow every 5 minutes. The max doses you can see here in the protocol are a little bit different. Aim for 2. Burns are going to be a little bit higher. Don't forget here about the intranasal route. I want to really emphasize this. Intranasal administration of medications is really cutting edge. It's very effective. It's easy, doesn't require a needle, and gives you some reliable blood levels as well as pain control. So for your first dose, while you're getting your IO or IV established, think about intranasal if you're going to use fentanyl. I don't believe we're going to carry morphine out at the airport, so I'm going to skip that one. We'll move on to ketamine. Now, ketamine is a non-opiate, although it's still a controlled substance. This one, I'm going to refer you to a video that I shot about mixing it, and I will include that with this. I'll include it in the email that I'll send you guys. But to be short, you're going to mix 0.3 milligrams per kilogram, or a max dose of 30 milligrams, in 50 to 100 cc's of normal saline, and you're going to administer it slow over 10 minutes. So ketamine is slow over 10 minutes. If the pain remains at or returns to moderate to severe pain, you can repeat the dose without a base order. So ketamine is mixed in a bag and dripped slowly. Fentanyl is given IV, IO, or IN. Remember, IN for the first dose, but if you're giving it IV, give it slow. And finally, ketamine does not have the blood pressure requirement. You'll notice, do not administer ketamine for any of the following conditions: if they're pregnant, altered, or have multi-system trauma or active bleeding. So really banged up trauma patients who are in a lot of pain, who have multi-system trauma, you can't use ketamine for. And the other thing is you want to not co-administer ketamine and opiates, okay? Take a look at the policy, and I will also attach the ketamine mixing and videos that I shot earlier. Okay, we'll see you on the next one.